So what this platelet-rich plasma does is to do what? Gather at the damaged site. Let's say it's your ankle joint that is damaged by arthritis. So this platelet-rich plasma will do what? Gather at that damaged site and then releases what we call the chemokines and the cytokines. Okay? And these cytokines and the chemokines will do what? Attach to your white blood cell. Hello everyone, you're welcome back to my YouTube channel. This is your girl Esther, okay, the one and only Lolo Obieze. I'm happy to have you all here. Thank you for subscribing to our YouTube channel. Thank you for liking. Thank you for the shares. Thank you for the comments. Indeed, I'm grateful. Thank you for coming back. Yeah. So on today's episode, I'm going to be talking about something that's been a concern to me. It pains me when I see our old mothers, fathers, and even the young ones suffering from pain, severe pain due to arthritis. When I know I can actually tell you something that can help relieve the symptoms for you and make you live longer and then be able to carry out your activities of daily living. That's why I'm talking about this arthritis today, okay? So, what is arthritis? Arthritis simply means a condition, it's a common condition that causes pain, swelling, and even stiffness in one or more joints, okay? That is what arthritis is all about. You see some persons complain of severe pain in one of their joints. You see them complain of inflammation, swelling. You see them complaining of stiffness. This can be as a result of arthritis. Okay? And what are the symptoms of arthritis? We have pain. We've got swelling, which is inflammation. We've got stiffness in one or more joints. These are the common symptoms of arthritis. Now, let's talk about the causes of this arthritis. To be honest with you, the major cause of arthritis is unknown. Okay, but there are contributing factors to arthritis and there are different types of arthritis. Now, I'm going to tell you the common types of arthritis and their causes. Okay, so stay tuned. Let's discuss further. First, we have osteoarthritis. What is osteoarthritis? Osteoarthritis is commonly caused by breakdown of tissues or cartilages in the joints. When there are breakdown of tissues or cartilages in your joints, this can result to osteoarthritis, okay? And there are other things that can lead to osteoarthritis, which includes injuries, previous injuries. Yes, if you've got an injury to one or more joints in your body, this can linger and then predispose you to osteoarthritis. We've got factors like family history, where there is a background history of osteoarthritis in the family. Yes, also we have aging, old age. The more you get older, the more your bones become weak and then they can cause your cartilages to give wear or tear, and that as a result of that leads to osteoarthritis. Okay, we have other things like overweight. Yes, when you are gaining so much weight, this can actually predispose you to having what? Osteoarthritis. And we have factors like bones or joints that don't form correctly, maybe during birth or something. If there is any problem with the joint, anything that makes the joint not to form correctly can predispose you to what? Osteoarthritis. We have another form of arthritis which is called rheumatoid arthritis. It's called rheumatoid arthritis. We've got lupus and we have scleroderma. This is actually a common type of arthritis that is caused by the autoimmune disorders, whereby the immune system begins to destroy its own tissues, attacking its own tissues, and thereby predisposing an individual to what? Rheumatoid arthritis. Okay, and this is commonly seen among women more than the men. Rheumatoid arthritis is seen mostly in women than the men. Here, the body system is fighting itself, the immune system is attacking its tissues, and thereby leading to what? Rheumatoid arthritis. We have another form of arthritis which is called the gout, G-O-U-T. This is another form of arthritis that is caused by high level of uric acid in the body. Yes, when there is a high level of uric acid in the body system, this predisposes an individual to what? Arthritis. And this type of arthritis called the gout arthritis is commonly seen in men than the women. This type of arthritis often happens because of buildup of crystals in the joint. When there are lots of crystals building up in the human joint, this can predispose an individual to developing what? Gout arthritis. Okay? We have another type of arthritis called the bacterial arthritis. Yes, you heard me. This is actually caused by bacterial infections like the urinary tract infections, okay? Staphylococcus aureus, staph. These are the major causes of bacterial arthritis. And in this bacterial arthritis, you'll find out that there is bacterial infection that is spreading throughout the human system, spreading throughout the bloodstream, whereby these infections circulate throughout the human body through the bloodstream and then settles in the joint. It can predispose an individual to developing what we call bacterial arthritis. Okay, So you can find out that with this type of arthritis, we, as I mentioned and discussed, different types of arthritis. You find out that these different types of arthritis can actually affect the human body, affect individuals, limit their mobility, and affect their normal human body function. You see people struggling with the activities of daily living, and is associated with these one or two types of arthritis that you find out today, as I've discussed with you. So as we discuss further, I'm going to let you know some of the treatments, some of the remedies, and some of the things you can actually do to help yourself when you find out that you've developed arthritis, or when you find out that you are suffering from arthritis. I will tell you some of the things you can do to help yourself ease the pain and then live and continue enjoying your life. Okay? So talking about the treatment of arthritis, the most important thing to do when it comes to arthritis is lifestyle changes. Yeah. When you've noticed that you've developed arthritis or you're suffering from arthritis, one of the things you can do is to change your what? Your lifestyle. Okay? Yeah. So when it comes to lifestyles, there are certain foods you should avoid, okay, when you've developed symptoms of arthritis, or even to help yourself manage arthritis, okay? You're not expected to eat red meat, okay? Refined carbohydrates, you're not expected to eat such food. You're not expected to eat puris, high salt food, okay? Reduce the intake of processed food and red meat. Reduce the intake of what? Added sugars. Yes, too much sugar is not good for the body. Okay, added sugars, refined food, refined carbohydrate, processed and red meat. Reduce the intake of this kind of food, even purines and high salt intake, please, to help manage your what? Arthritis. And there are products called age products. You're not expected to eat age products when you've got arthritis, or when you find out there is a history of arthritis in your lineage, in your family history. You're not expected to consume age food. Age food simply means advanced glycation end products. These are called age products. So you're not expected to eat age products when you know you've got symptoms of arthritis, or when you know you want to help manage or relieve your symptoms of arthritis. Okay, so talking about weight loss, yes, weight loss is another thing you should do to help manage your symptoms of arthritis. Try to reduce your weight, carry out regular exercises, but when you exercise, it helps to keep your muscles, it helps to keep your joints free and flexible to help you manage what? Arthritis. You can also use cold or heat ice pack. Yes, when you know you've got swelling in any part of your body, swelling simply means inflammation, and when there is pain in any part of your joint due to arthritis, you can actually use ice or heat compress like ice pack to help manage your what? Pain. One other thing you can do is to what? Do regular exercises. Okay? Continue your physiotherapy. Yes, you can register with a physiotherapy and then carry out a physiotherapy section with your physiotherapist. There can be help. Your symptoms can be relieved. Yes, one other things you can do to help yourself with this arthritis is what? Reducing your weight. When you notice that you've gained a lot of weight, you can actually work on your weight to reduce your weight, and you'll find out that your symptoms will do what? Disappear when you work on your weight. Okay, that is why it's so important to maintain a normal body weight. Now let's talk about medicines. Okay, we've talked about using lifestyle as a way of managing your arthritis pain. Now we're talking about medicines. There are certain medications you can actually use to help relieve or manage your symptoms of arthritis. Okay, these are called NSAIDs. What are NSAIDs? They are called non-steroidal anti-inflammatory drugs. Okay, we've got medications like naproxen, we've got medications like ibuprofen. Okay, these are non-steroidal anti-inflammatory drugs that people normally use or consume to help relieve the symptoms of arthritis. Some of this medication, in fact, NSAIDs actually cause or trigger stomach upset. Yes, you see some persons that are taking a lot of NSAIDs, that's the non-steroidal anti-inflammatory drug, they come up with stomach upset, they come up with ulcers, stomach ulcers. Okay, this can be as a result of what? Overconsumption of NSAIDs. They are using this medication actually to help manage their symptom of arthritis, but this medication may not be safe for you, okay, and might trigger or cause something else in your body. So whenever you're using any medication, make sure it's recommended by your doctor. Some of these NSAIDs can actually cause cardiovascular problems. What are cardiovascular problems? These are the heart problems, okay, and they can also affect or cause you to bleed. Yes, this can also cause bleeding problems. So when you are using NSAIDs, be safe and make sure it's prescribed by your doctor. Also, you can actually get NSAIDs that are gel, the ones that you apply on the skin. This may have little or no side effects. So it's better when you've got symptoms of arthritis, you can actually use the ones you can apply on the skin, like the gels. Okay, you've got ibuprofen gel, you've got other heat gel that you can actually apply on your skin to help manage your symptoms of arthritis. We have other medication that can actually help with your treatment of arthritis, and they're called corticosteroids. Steroids are actually medications like prednisolone. These are medications that helps you with the inflammation and reduce what? Joint damage. These medications are given by your doctors or are prescribed by your doctors to help you with the pain you're having with arthritis. They help you reduce or prevent joint damage. You can actually help yourself by taking supplements and then vitamins, because there are some vitamins like the calcium that can help you with your bone, making your bone strong, to help you build up your bone tissues formation and then help you with the pain you're having. That's why it's actually important for you to do what? Keep on top of your what? Vitamins and supplements. Calciums, vitamin D, they can actually help you make your bone stronger, help you reduce the risk of joint damage, and help you relieve your what? Arthritis. Now, let's go to what? Surgery. Now, let's go to what? Injections. I've been in the UK for like 2 years now. Unfortunately, I'm working in a unit where we do a lot of procedures, spine, orthopedics to help manage arthritis. Now, I'm going to tell you something very, very interesting. So, if you have watched up to this point and you've not subscribed to my YouTube channel, what are you waiting for? Now, I'm going to talk about something very, very crucial. Please hit the subscription button, subscribe, like, share, comment, and this will encourage me to do more. I hope you love what I'm saying. If you love it, give me a thumbs up. Now, in my unit where we work, we've got doctors, spine doctors, orthopedic doctors that helps to administer steroid injection to people with arthritis. Yes, we've got two different types of things they do to help people with arthritis. One, we've got the administration of steroid injections, and then we've got the administration of platelet-rich plasma. What is this steroid injection? You know, I told you about the steroid medications like the prednisolone that doctors often prescribe to help manage your symptoms of arthritis. Here in the UK, they actually administer these injections like the steroid, corticosteroid injections. They actually administer it with what? A local anesthetic, and they do this under X-ray guided to know the exact joint that are administering this medication. Okay? You know, when you fall sick or when you have an injury, the body actually releases what? Inflammatory cells that help you to aid what? Healing. So what this steroid injection does is to help calm your immune system, calm the inflammatory cells that your body has actually sent out to help tackle the problem. And you know, some problems like some injuries can be chronic and last for a very long time. So what this steroid injection does is to do what? Calm your inflammatory cells, calm those responses so that your pain can go, your inflammation can disappear. Yes, and when this disappears, it helps you to engage more. You engage more in your activities of daily living. Your swellings will go. All the pains you've had in the past will actually do what? Disappear. But unfortunately, this steroid injection can only last you for what? Couple of weeks or months. Yes, and you see the pain come back. That's one of the disadvantages of what? These steroid injections. At first, they help to do what? Calm the inflammatory cells that your body has sent to fight or to tackle. And you know, when your body is fighting and trying to heal what is not healing, actually, there is inflammation, is going to give you more pain. So the steroid injection, once administered to you, will help calm what? Those inflammatory responses and thereby relieving your what? Arthritis symptoms. I hope you understood what I just explained. So when your pain and your symptoms are gone or are lesser, they help you to engage more. They help you to engage in what? Rehabilitation. Okay, and you can even what? Carry on with physiotherapy, and you find out that your symptoms have gone completely or your symptoms have reduced to the barest minimum. We have another type of injection that they normally do here in the UK, which is called the what? Platelet-rich plasma. Yes, you heard me. Platelet-rich plasma. What is platelet? You know, platelet is actually one of the blood types, okay? They are produced in the bone marrow and they circulate throughout the whole body system, okay? They help to stop bleeding, and also they help to do what? They have anti-inflammatory effects. Yes, you heard me. Platelet is one of the blood types. One of the functions of this platelet is to do what? Help to prevent bleeding. Platelet originate from the bone marrow and they circulate all throughout the human body, okay? What is the work of this platelet? Platelet actually help to do what? Aid healing process, and they have anti-inflammatory what? Effects. What actually happens here is that the doctors will do what? Collect a blood. You know, I told you platelets circulate all throughout your body. Once they collect a blood sample from you, they put it in a centrifuge, and then what? Once it settles, they'll collect the rich plasma. Yes, that's what they need. The plasma is actually coming from your blood. They collect the blood from you, put it in a machine called the centrifuge. They take the plasma, the rich portion, rich plasma, take it off you, and then inject it directly to the joint that is giving you problem. Yeah, that's what happens. They take the plasma, inject it directly under X-ray. Remember, I told you any injection you're having is going to be what? Under X-ray guided, to make sure that directly injecting it to the particular joint and where it should what? go into. So what this platelet-rich plasma does is to do what? Gather at the damaged site. Let's say it's your ankle joint that is damaged by arthritis. So this platelet-rich plasma will do what? Gather at that damaged site and then releases what we call the chemokines and the cytokines. Okay? And these cytokines and the chemokines will do what? Attach to your white blood cell. And once it attaches to your white blood cell, yeah, you know the work of the white blood cell is to fight infections, fight any problem with your body, diseases, infections. The white blood cell helps to attack it. So the cytokines and the chemokines that have been released by this platelet will do what? Attach to the white blood cell and thereby doing what? Tackling that problem of inflammation you're having. Yes, they're tackling that inflammation, stopping you from having swelling, stopping you from having the pain, okay? Giving you symptomatic relief. These are the good news and what people in the UK have been experiencing and they've been enjoying. You see most of them living pain-free. Yeah, they've got so many things they can actually do to help live longer and continue to carry out their activities of daily living. I don't know if you've got some hospitals in Nigeria that have the spine doctors. Yes, you can actually have this injection in any part of your body where there is a joint. Okay, your sciatic nerve might be giving you problems due to arthritis. Doctors might decide to check, do a CT scan, do an MRI to find out what is actually causing this pain for you. It may be because of arthritis, and one of the symptomatic relief for you can be doing what? Having this injection. Yeah, when you have the steroid injection, if your doctor allows you to do so, or when you have this platelet-rich plasma injection, these are symptomatic relief for this arthritis pain. And you know, you can even actually have injections up to 4 times in a year. Yeah, some persons, it depends on your symptoms and how your doctor wants to manage you. So my lovelies, I think I've been able to enlighten you a bit about arthritis, what arthritis is, the pain and everything associated with arthritis and the different types of arthritis and what you can actually do to help manage your arthritis. Okay, if you've got any orthopedic doctor, any spine doctor, okay, that can help manage your arthritis, you discuss with your doctor, you may benefit from having an injection that can give you a very good symptomatic relief from your arthritis pain. Yeah, because I can see and I can testify that people are benefiting a lot from having injections, like the steroid injections, like the platelet-rich plasma injections. And you know, these platelet-rich plasma injection, they're actually healing agents, and they can give what? A longer, yeah, they can give a longer lasting effect for your arthritis pain. Yes, they can give you a very long symptomatic relief for your arthritis pain, unlike the steroid injection. So discuss with your doctor and then decide and choose the best one for you. Okay? Thank you for listening, and I hope I've been able to educate you. I hope I've been able to give you an insight of what arthritis is all about, how to manage your arthritis, and actually give you an insight that there is something called an injection, steroid injection that you can have, which will give you a symptomatic relief, and then the platelet-rich plasma injection that can also help you manage your arthritis pain. So, thank you for tuning in once again. If you have any questions, just do what? Ask, comment, drop your comment, drop your questions, and I'm glad and happy ever ready to do what? Answer you. Thank you for tuning in. I love you all, and it's still your one and only Lolo Obieze. Okay? See you next time.